High blood pressure. You hear about it all the time, but what does it actually mean for you? Let's break it down. Simple, no jargon, just the facts. So, hypertension, or high blood pressure, is when the force of blood pushing against your artery walls is consistently too high. Over time, this pressure can cause some serious damage, even if you feel totally fine right now. That's why it's often called the silent killer. Why does it happen? Well, it's not just about salt or stress, though they matter. Genetics, age, being overweight, smoking, not getting enough exercise, getting older. Sometimes it runs in families. Other times, it's all about lifestyle. Now let's talk numbers. When you get your blood pressure checked, you'll see two numbers, like 120/80. The top number, systolic, measures the pressure when your heart beats. The bottom, diastolic, is the pressure in between beats when your heart relaxes. Ideally, you want to be under 120/80. If you're consistently over 130/80, that's when doctors start worrying. But why should you care? Because high blood pressure is a huge risk factor for heart attacks, strokes, kidney problems, and even vision loss. It doesn't just affect older folks either. More young people are being diagnosed every year. Sometimes you don't feel any symptoms at all until things get serious. That's why regular checkups matter. So, what can you do about it? The good news? A lot. Small changes add up. Fruits and veggies, cutting back on salt, moving your body, more, quitting smoking, managing stress. Even dropping a few pounds can make a difference. And yes, for some people, medication is part of the plan. Here's the thing, I know it can sound overwhelming, but you don't have to do everything at once. Start with one healthy habit and build from there. If you're not sure where to begin, ask your doctor for advice that fits your life. Bottom line, high blood pressure isn't something to ignore, but with the right steps you can take charge of your health. Remember, checking your blood pressure regularly is simple, but it could save your life. Thanks for listening. If you found this helpful, consider sharing it with someone who could use a reminder. Because knowledge really is power. Stay healthy, and see you next time.